Thank you for joining us today. My name is Leah Zickmund. I'm the executive director here at Hourglass. I'm here today with Jill Kaylor and Megan Gray, both from Visiting Angels, who will talk to us a little bit more about their services, some of the high points of the work that they're doing, and maybe some of the challenges that they're seeing in the next few years. So Jill and Megan, thank you so much for joining today. It's great to talk to you again.
Thank you for having us.
Yes, thank you so
Absolutely.
much.
I would love for you both just to take some time to introduce who you are and what you do at Visiting Angels from a high level before we kind of dive in.
Sure, I'll try to go ahead and jump in.
Go for it,
All
Jill.
right, so I'm Jill Kaylor with Visiting Angels, as Leah said. I am the provider relations specialist, which is pretty much a fancy title for marketing, sales, and community education for our three offices. We have one in Lancaster, and then also one in York and one in Hanover, and I cover all three of them. Basically, what I do is I tell everyone about Visiting Angels. I do a lot of community events. I represent us out in the community. I do a lot of presentations on various health and wellness related topics for mostly for older adults. A lot of the services that we provide, which we'll certainly talk about, are for typically older adults, but we do care for people that are 18 and over. And a lot of what I do is, again, just connecting with the community, letting people know who we are, how we can help individuals throughout all of our communities to stay safe in their homes and to get the help that they might need following hospitalization or following an illness, or if they're just becoming older, a little more frail and just need a little bit of extra help to stay safe and to stay as independent as possible. That's where we come into play. So that is who I am, and I'll certainly tell you more about Visiting Angels as we go throughout the interview.
Thanks, Jill.
Sure.
Megan, tell us about what you do.
My name is Meghan Gray. I am the director of our Lancaster office. I've worked for Visiting Angels for a little over 10 years. I started out in the York office actually as a caregiver. I came to work for Visiting Angels as a caregiver. And when I finished college, I moved into their care manager position. Very unique to Visiting Angels. We have care managers that are very much like social workers that manage our clients and the caregivers to make sure we're meeting their needs in the home. And then about 2 years ago, I was promoted to director of the Lancaster office. So that is where I've been for the last 2 years. And we have over 200 caregivers in Lancaster, and we're busy serving our community over here.
That's awesome, Megan. And I'm glad that you mentioned your caregiving experience because I plan on, kind of digging into that and asking you guys a little bit more. One thing I wanted to start off with is you all have clarified that this is non-medical home care. Can you talk about what that means and why is that necessary in conjunction with medical home care?
Sure, sure. So there's actually three different types of home care in Pennsylvania. There's the skilled home care, which would be like nurses, RNs, physical and occupational therapy, a lot of skilled high-level nursing care that someone is provided in the home. There's also hospice that is for individuals who have a life-limiting illness and are nearing the end of their lives, and then they need a little bit of extra support through that transition. And then there's us, and we are non-medical home care. And what that means is we will provide pretty much all of those things that wouldn't be included with the other ones I listed, but all things really considered non-medical, like help with activities of daily living, bathing and dressing, assistance with meal preparation. We also do transportation to doctor's appointments, to the grocery store for medical testing, those types of things, light housekeeping, medication reminders, take the trash out. We change the bed linens. We help people if they need compression stockings, need those put on. We, gosh, the list can go on and on and on. There actually can be a very long list. So that's kind of just a general idea of what we do. But again, the goal is that we know that people are leaving the hospital and maybe don't have family members in the area to help them, or maybe their family members are working or are otherwise occupied, and or there are some family members that just don't feel comfortable doing those things that, those intimate caregiving things. So that's where we can come in and help. Again, following hospitalization, if a person just is ill and is a little more frail and needs some of those things to keep them in their home instead of moving into a personal care home or a nursing home or retirement community, wherever they might be living is where we can provide that care. And in fact, we actually do provide services for people in nursing homes because that way they're getting some one-on-one care that they might not already receive through that particular facility that they're in. We go to really, again, wherever. We even go into the hospital. There are times that we go into the hospital where the person has just had surgery and they just need some one-on-one support. And then something that we're really proud of is providing care for individuals living with dementia. And we have a lot of people in our communities that are living with dementia. So, just providing support for them because they may just not understand or not maybe don't remember how to make a proper meal and to stay to make sure that they're getting nutrition and hydration, to remember when to take their pills, to remember that it's probably time for them to get a shower, like those things that are just really we take for granted and they're obviously essentials for us. We want to continue to help support people with those types of things too. What did I miss, Megan? You've
Yeah,
done this
you
for a
got
long time
it.
too, so.
You got it. And just to piggyback a little bit off that with the non-medical home care, I think it's also important to mention right now that insurances do not cover non-medical home care. And unless you have long-term care insurance, a long-term care insurance policy, some of those policies will cover the in-home non-medical home care, or you have a state assisted program such as waiver, or the caregiver reimbursement program. There's a few programs through the county that will cover our services. They are not covered under, insurance, Medicare,
Yeah.
things like that.
Yeah, I always say that since we're non-medical, medical insurances do not cover us. It's kind of just that simple, although it can be very confusing for individuals. Also, too, there are veterans benefits. So some people do tap into the veterans benefits. Will help them kind of navigate that and figure all of that out and get connected with the Veterans Administration in the county where they're living to be able to find out what the threshold is from a financial standpoint, if they've served, like what are all the qualifications. So they'll have individuals that can help them with that too. There are some grants out there that we can tap into. They're kind of few and far between, but there's some out there as well. But correct me if I'm wrong, Megan. I mean, most people do pay privately, and it may not be that individual that's receiving the care that's paying privately, but it could be a family member that's helping to support because they know that, in order for mom to be happy and for her to stay at home, we might need to, supplement some of this and help someone, periodically. The other thing that I wanted to mention too is that we can provide anywhere from 3 hours to 24 hours. So we have individuals that maybe just use us once, let's say for transportation to and from a colonoscopy, because we all know that we're not allowed to drive home by ourselves after colonoscopy. And if they need that type of service, or they're getting medical testing of some sort, there could be an individual that's able to, get them there, get them home, get them settled, that type of thing. We also have people on the other end of the spectrum. I mentioned earlier about hospice. So it could be someone that's receiving hospice care, but they need someone in their home 24 hours a day, or they're requesting that type of care 24 hours a day. So that's where we would come in and be there 24 hours a day to support that individual and to help keep them comfortable, working alongside the hospice program, and then everything in between. So we have individuals that are using us maybe every other day. They could be using us every day. They could be using us a couple times a month, a couple times a week. Like it's really the two ends of the spectrum and everything in the middle. And it's very, very much individualized according to the needs of that particular client and certainly, respecting what their family is requesting as well.
Sure. That definitely paints a picture for me, I think, of the value and the breadth of services that you
Mhm.
all provide. I'm curious if you could paint a picture in whatever way, numbers, stories, that sort of thing, of the demand for this service right now, and maybe what people don't understand about that demand of this
Yeah,
type of service.
absolutely. I mean, Megan, go ahead if you want to hit that, and I can jump into then.
I'll let you, because I know you have numbers and probably some statistics about the older adult population. And really, we do serve individuals 18 and older. We can, but most of our clients are older adults. But
Yeah.
the need is great. People want to stay home or wherever their home is. Sometimes it's living with a family member. Sometimes it's in a continuing retirement community. They want to be at home and they are just needing that little bit of support to be there. So, like Jill said, sometimes it's just a medication reminder or let's get a shower today. And they need a 3-hour shift 1 day a week. And that allows them to be at home maybe an extra month, 6 months, 6 years. I mean, it really can vary to each individual, but this need is in very high demand right.
Yeah, it absolutely is. And to your point, Megan, there was a study done, I think it was 2022 by AARP and the University of Michigan that said, I think it's 84% of people surveyed said that they wanted to be in their home for as long as possible. I honestly think that would be a lot higher. So I'm kind of like, is that really what people said? Because I would think they would be closer to 90 or higher of the amount of people surveyed would want to live in their homes for as long as possible, again, to wherever that home is. And it could be in a retirement community, it could be in-law quarters with their family, it could be on their own, it could be in an apartment. I mean, really, their home is wherever their home is. But most people, when you ask them, that's where they want to be. And certainly that's where we come into play because our goal is to help them do that for as long as possible. And yes, our world and our nation and our state and our counties are there's people that are living a lot longer, and we're actually seeing a shift. Whereas the baby boomers, we're seeing the baby boomers, pretty much nearing or at that retirement age, if they haven't already. And we're also seeing too that there's a lot of we're seeing that there's the less people being born, and there's more people living longer. So when we had a lot more younger people and a lot less older people, we're actually seeing that shift now. And our population is going to become much older over the years. In fact, we just had the announcement that Pennsylvania is the 13th state in the nation to become age friendly and age like to have that focus. So they're recognizing that obviously, we in Pennsylvania, we have people, we have a pretty high percentage of older adults in our state, and that's going to continue to grow. And so, what do we need to do? We want to try to find ways to continue to help those individuals. So that's again where we kind of come into play. The challenge is we need more caregivers too. We need more people to provide that care. And that's, we do run into that challenge from time to time, making sure that we have enough caregivers. And sometimes we don't. But when we're constantly, hiring individuals that are looking, to be a caregiver, and we want to be able to build them up and to train them and to provide them with a lot of great education and the skills to be able to do that work that is so crucial.
I'm so glad you said that because I wanted to shift our conversation to, we've kind of established what you all do and what the need is, what the demand
Mhm.
is. So I'm curious, like, how you all feel well equipped to meet that demand with your network of caregivers. I think, Megan, you said you have about 200 right now in the network that you oversee. Who are those caregivers? How do they come to you all? And what's working there?
Our caregivers, they we have students that are in college that will just work for us in the summer or over a break. We have stay-at-home moms that are work for us just during the school year, while their kids are in school. We have retired individuals, men and women that will retire and then just want to do something part-time, and they'll come to work for us part-time. I really, a very wide variety of caregivers. And we have lots of trainings that you don't need to experience. We can train you. We can show you. You just need the heart. You just need the heart of a caregiver. You have to want to serve your community and help others. And as long as you have that drive, we can show you the rest. We have skills labs that we on site. We have a whole skills lab that caregivers can come in and do, and we can work with them. We have Visiting Angels University, which is a online training with various courses that we can have the caregivers come in and do, from end of life to just hospice care, end of life, and then just how to use a bedpan, or anything, a walker, wheelchair. It can just everything. It can show the caregivers. And then we also have in-person trainings. Jill is our dementia specialist. So Jill is one of them, but she's a wealth of knowledge. I mean, she not only goes around the entire county educating people, police officers, I mean, you name it, they're doing what she needs to do. But we also have palliative care trainings in person, and we have Passages, which is our dementia program that we do in person 2-day trainings yearly. So yeah,
a lot of opportunities to train individuals. Yeah. And people come to us. We get a lot of word of mouth. We get a lot of people, not just clients coming to us from word of mouth, but also caregivers. And we encourage our current caregivers to bring other good people like them to our doors. There's incentives for them, like sign on or referral bonuses and things like that are great. But also, again, to Meghan's point, I mean, we have a lot of offers for and a lot of opportunities, I should say, for training, because we don't want someone to be out there floundering. I mean, certainly they're going to be in that person's home by themselves, and it can be a little daunting. Like, how does that feel, not just for the client, but for the caregiver? And so we want to give them support. So as Meghan mentioned before too, we have care managers that are social workers, and they oversee the care that is being provided to those clients. But they also are able to connect with those clients with other resources in the community, because we know that we're not the end all be all for everybody. I mean, there's times that people are like, oh gosh, I really need to update my will, or I need to get a power of attorney, or I need oxygen, or there's so many things that an individual might need, and that's where that care manager, who oversees, again, all of the clients that we have, is able to connect them with other resources beyond who we are at Visiting Angels. So they are doing a lot of those things. They're doing the resource connection, but they're also making sure that the caregivers are supported and are doing what we agree to do for that person, that particular individual and that family. And our goal is to make sure that those caregivers feel comfortable, in the home, and through this trainings, in person, online, all of those things that we can offer to them. So that's important for us, because I mean, they are the lifeblood of what we do. I mean, obviously. And the cool part is that we have, so there's like 200 in Lancaster, and then we have our Hanover and York office. So we have over 500 caregivers across like the South Central PA area. So we have a lot of people that are working with us to provide great care in the home. So it's pretty cool.
That's awesome. And it sounds like you all are, constantly improving upon how you're building your community, how you're building your network. Something we talked about the last time we spoke was partnerships that you have with local universities. Would you be able to talk a little bit about that?
Sure. So we do work with Millersville. We've had interns to come over and help with that. We've worked with Lancaster Career and Technology, and we've had their nursing students come and shadow our caregivers to learn about in-home care, because there's lots of different kind of care, and we're passionate about in-home care. So we want to teach people about it. Of course, we want people to go into this field of work as well. So we've hosted their students and had them come work for us as well as they're going through the nursing program. They've come and work for us while they're doing that. So those are two partnerships I can think of,
A
right
lot
off
of
the
job
top.
fairs. Yeah, we also I'm on the occupational advisory board at York Tech. So I know it's not Lancaster, but still, it's kind of along the same lines, obviously, right across the Great Divide, the Susquehanna River. But we work with them and help them with their curriculum, and we're constantly talking about what we can do to try to help, as Meghan said, help to lift up this workforce because it can be a career. It's not just like a stepping stone for people, but for some people it is a career. And we're out actually, kind of a side note too. We had a management meeting yesterday, and we're working on a career ladder with it internally. So we want to be able to have our caregivers, just to reinforce and acknowledge the knowledge that they have and the trainings that they're going through and how they want to grow within our company as well. So there's that side of it too. We also have worked with a CNA training program, so our caregivers don't have to be trained, or as Meghan said, and nor do they have to be certified, but it is certainly, again, another step for them, another career approach for them to have that CNA. So there are some that want to go through that, but they just maybe don't know how to or who to get connected with, the cost of it, all of those things. So we are connecting with some organizations in our community that either provide CNA training at low to no cost, or those that there is a cost and maybe we'll do a scholarship for that individual. So we're working with some programs with that too. So that's kind of another extension of that.
That's awesome. Well, like I said before we started, this time was going to go by really quickly.
For sure.
We are here at the end, and I want to ask you both just one final question, however you want to answer. Um, a big part of framing this conversation was understanding that in the coming years, our aging population is going to need a lot from the community and many different channels of service and support. I'm curious if both of you could speak to maybe some fears and some hopes for how Visiting Angels will be able to kind of meet that demand in the future.
Go ahead, Megan. Anything you can think of?
Well, at Visiting Angels, Jill has mentioned, we are very passionate about dementia and the future of dementia and how to give individuals that have this diagnosis the best quality of life they can. And we're seeing a huge rise in that. Jill, you just had sent out an email with some statistics that had came out. Was it 1 in 3? What was it?
Yeah. I think the governor said last week it's 1 in 4 currently,
1 in 4.
and in the next number of years it'll be 1 in 3. Yeah, in Penn, I think that's in Pennsylvania alone. Yeah,
Yeah.
which is staggering.
Yeah.
So there's that.
There's that, and that's on our radar. And we see
Mhm.
this coming down the pipeline, and we're really trying to educate ourselves so that we can go out and educate the community. And there's a lot of family caregivers right now that need support. We're seeing a big need in that. Like, they're trying to care for their loved one, the burnout, they need some support, some respite care. So we're doing our best to get educational materials out, provide education to the community so we can tackle this, because it's definitely worrisome.
And there's a lot of stigma, and we want to try to reduce the stigma and increase awareness in general. I mean, we're very active with the Alzheimer's Association and their Walk to End Alzheimer's, which happens every fall. So we have a team. We've been one of the top teams in both Lancaster and York over the years. We've been a top team in our entire company recently over the last like a couple years ago. So we really have a lot of great resources and connections in our community to raise money, but also to raise awareness about Alzheimer's and other types of dementia. And I think another thing too that we've been really actively working on as well, and Megan could certainly jump in with this too, because we've worked on this together, is we're trying to make better strides and get more connected with our underserved communities, let's say. So we worked with SACA, we've talked to Tech Centro, and trying to, because let's be honest, a majority of our clients are English is their primary language, and born and bred in Pennsylvania. So we want to be able to reach the other populations that are growing in our Lancaster community. So we're trying to look at what we can do to have translators to translate some of our written material, to just find ways to connect and support you know other populations. So we that's something that's important to us as well, to reach pretty much anyone that we can. We know that some of the other populations are just they may actually have multiple people, multiple generations living under the roof, and everyone's caring for each other, but that's not always the case. So how can we just provide support for them as well? And if there's a language barrier, that's really hard for us. So we want to try to overcome that. That's a big challenge for us right now, and we're hoping to overcome that in the future as well.
Absolutely. It's definitely a lot of room for, it sounds like, learning, connecting with new organizations in the community.
Absolutely.
Hopefully people in the Hourglass community who are watching this, if you see any room for collaboration that could be added there, that can come from this. But Jill, Megan, thank you so much for your time, for what you're doing. It's been really lovely just kind of like learning from you all and the things that I didn't know about Visiting Angels until we started digging into it a little bit more. So thanks for working with us here at Hourglass, and for sharing some insights about what you do.
Well, thank you for the opportunity. We appreciate it.
Thank
Absolutely.
you.